Good afternoon, ladies and gentlemen. I am Dr. Vinod Raina. Today we are going to talk about erectile dysfunction. ED. It's a disease when a patient is not able to do sex. When a patient wants to perform, he wants to have sex on the bed, he's not able to do it. Or he starts with the sex, it is going on, then abruptly he loses direction. Or he's doing sex and he's just started it, and within few seconds the patient gets ejaculated. So that process is called erectile dysfunction. So what are the causes? There are a number of causes for ED. ED takes place in those patients who are not active in sports activities, in exercise, in their lifestyle. For example, if a patient is obese, his weight is higher than BMI, then definitely the patient can have erectile dysfunction. And let me tell you guys that in lifespan, the patient will have at least 3-4 times erectile dysfunction. It can be temporary, but sometimes if you are not treating it properly, it can be permanent. So, if you are smoking, that's a big problem. The patients who smoke, what they do, they smoke the cigarette. That smoke goes in the lungs, and from lungs, this smoke is mixed with the blood. It's then transferred to the heart, and heart pumps it to all the parts of the body. And in that scenario, the patient who is having the blockage of the microvessels will have the ED. And penis is a muscle. So there are a number of microvessels present in the penis. So when you smoke, this all tar, coal, it is transferred through the blood to all the parts of the body. And this tar coal clogs the veins, the arteries, goes through these vessels. They get choked, they get blocked. And when a patient is having the disease of blockage in the region of penis, he will have definitely the erectile dysfunction because the circulation of the blood will not take place. Guys, if a patient is drinking too much, alcohol is not bad at all. In Europe, in foreign countries, they take alcohol in a limited way. But the problem starts when you start drinking it on a very high level. That's the problem. When you drink much of the alcohol, it will create a toxicity in your body. All the vitamins, all the carbohydrates, all the minerals are washed away from the body. And you become weaker. There is a problem in the liver. The synthesis of proteins does not take place in. Why? Because the liver is fatty, the liver is having problems. The SGOT, LGBT, gamma GGTP, these are all enzymes which get affected when you drink. So, it's a message to those guys who drink heavily that please stop drinking. You can have a good life. And the people who are under stress, they're working from morning and evening. They get up early in the morning, they don't have time for the walk, they don't walk, they don't do breakfast properly, they skip the lunch, and in the night, they're hungry, they are fatigued, they are depressed, they are stressed. So what they will do? They will sit on the table and eat too much of food. So that will create the obesity. So guys, once again, you have to be fit. In order to be fit, you have to walk 45 minutes a day. Take 10 to 15 minutes daily. 1 to 2 walnuts daily. You have to take high protein diet. What does the meaning of high protein diet? If you are a non-vegetarian, you can take fish. If you're a vegetarian, you can take cheese, paneer. You can take kathal. You can take kali urad ki dal. And you can take broccoli. You can take vegetables. And if you want to have high level of proteins, high level of carbohydrates, high level of vitamins in your body, then you have to take the fruits daily. Intake of fruits should be there. So guys, now, if you want to have a good erection, you have to take arginine. The level of arginine should be increased in the body. So for that, you have to walk. Walking is the only process by which the arginine level in the body increases. So walk daily, 45, 50, 60 minutes daily, at least 6 kilometers a day. Arginine is present in watermelon also. It is present in pomegranate also. अनार जिसको हम हिंदी में बोलते हैं. You can take apple a day. You can take pears, apricot, ananas, grapes. So every seasonal fruit is important. So guys, if you want to remain fit and your sexual life should be good, then for that, you have to walk, you have to take a proper diet, and if by doing so, you are even having the erectile dysfunction, then please consult a doctor. Consult a good doctor, a qualified doctor. Because when you go to the doctor, when he is qualified, he knows that how the hormones work. FSH, LH, protein, testosterone, human growth hormone, dopamine, adrenaline, all the good hormones, how they work in the body. So my request is that please, if there is an ED, go to a special doctor for sexual dysfunction, that's called sexologist. He should be qualified. And he will give you some medicines. You have to take medicines for 2 to 3 months and you will probably be solved. But the question is that what you have not to do. Stop smoking. Stop drinking. Stop eating too much. So if you are doing these things, definitely you will never visit any doctor for sexual dysfunction or ED. So guys, my name is Dr. Vinod Raina. You can just send me a mail, or you can visit my website, drvinodreina.com, or you can subscribe my channel, or you can just send me a comment. And if you want to make any video on any disease, please write in the comments. I will try my best to answer you or to make a video for that. Till then, good night. Thank you.